this is Susan Brown, Director of the Center for Better Bones. Today I want to talk about that question of how do you know if you're losing excessive bone right now? Every day, clients come to me with a great concern about their bone health. They might have been told that their bone density is that of an 80-year-old and they're going to fracture and spend the rest of their life crippled. They might have been told that they really have to take bone drugs. Part of the answer to this whole question is finding out, are you losing bone right now? For example, a 50-year-old woman comes to my office and says, at 50, I got a bone density test, right when I started menopause. And then I was fine, I went through menopause. At 56, I went back to the doctor and they did another bone density test. The doctor then calls me up and says, oh, this is horrible, you've lost 10% of your bone mass over the last 6 years, you really need to be on a bone drug. So our question here at the Center for Better Bones is, that's fine, you had a menopausal bone loss, and we remember that the average woman loses 10% of her bone loss in those first 5 years before menopause and the first 5 years after. But the real question here now is that bone loss still going on, or has that bone loss come to an end? So I'm happy to tell you here today there's a very simple test you can take to find out if you are undergoing excessive bone loss right at this time, or if that excessive bone loss, or if that bone loss has quieted down, like is the natural tendency. And that test is called a marker of bone resorption. Here at the Center for Better Bones, the marker of bone resorption, that is the marker of bone breakdown that we like, is called the NTX. That's the N-teleopeptide test, and it's a very simple urine test. Let me tell you how it works. Bone is very much like, let's say, a protein sponge upon which minerals sit. So you have this protein sponge. When you lose bone, fragments of that protein, they're bone proteins, fragments of those bone proteins show up in the urine. So all you do is take a urine sample and you look at how much bone protein is in there. The part of the bone protein they're looking at are called N-telopeptides. And so you simply look at those N-telopeptides and you can tell, is your bone loss that of a young person? Is it that of a person who's undergoing rapid bone loss? Or is that of a person whose bone loss has stabilized? Now, I'm going to tell you a couple tips about the NTX. First, let me say that there's many other markers of bone resorption. There's the CTX, the DPD. We like the NTX because the reference ranges are really well established. The average premenopausal mean for bone breakdown as measured by the NTX is 36. So if you're premenopause, let's say in your 40s, you go to a doctor to get your bone breakdown test, it's going to be hopefully right around 36, somewhere in that range. In menopause, those numbers can go up to 60, 70, even higher. And in situations where you have other problems where bone is breaking down a great deal, like in Paget's disease or even in bone cancer, those numbers get very high. You can have 100 and above where you're having really unusual bone breakdown. We know that at 36, you should be building and breaking down the same amount of bone. We know if the NTX is 50, which is very common when women get to be beyond menopause, perhaps when they're 60 or so and that rapid menopausal bone loss is quieted down, an NTX reading of 60, really an NTX reading of 50 at the age of 60 years, means that you're probably breaking down 1% of bone a year. So what we like to see when we do an NTX test, we like to see it be in the 40s, which means you're pretty close to that premenopausal mean. We're okay with 50s, knowing that the average woman, by the time she's 60, is losing to 0.5 to 1% of bone a year. If you come back with a 65 reading, a 70 reading, even a 60 reading, we know that we want to work to reduce that bone breakdown. It's probably too much bone breakdown. So it's quite very simple test. You can actually order it online. And in fact, if you go to the betterbones.com website, scroll way down to the bottom, you'll see Support Our Foundation. And we have a link with a company called Direct Labs where you can order this test yourself for $69. This test was developed actually to see if the bone drugs were working. Remember, most bone drugs halt bone breakdown. This is a test of bone breakdown. So if you happen to be on a drug therapy, it's very important to get this test to see, is the drug therapy working? Is it bringing your numbers down, like to 36 and below? Now, there is an interesting caveat here. You can get too low on these numbers of bone breakdown. And this is the problem you'll hear with many drugs, where an individual will say, gosh, I was taking this bone drug and I up and fractured my leg, or they pulled out a tooth and the socket did not heal. That's because the drug has halted bone breakdown too much and bone does not renew itself. Every time you halt bone breakdown, you also halt bone buildup. That process is extremely coupled. You break down bone and you build up bone. You want them to be nice and level. At menopause, you start breaking down more, then you build up. You want to try to keep those level. In youth, you build up a lot more than you break down. When you take the drugs, it really halts bone breakdown, but at the same time, it forces bone buildup to lower. So you have very little renewal of bone. If you are on a drug therapy, you want to make sure your numbers don't get too low. Like in the teens, I'd take some concern that the drug was perhaps too strong for you. Here at the Center for Better Bones, we're mainly looking at helping individuals determine the answer to that very interesting question, am I losing bone right now? Or was that bone loss that you saw on the 2 bone density reports, which were maybe 6 years apart, was that bone loss something of the past and now the bone has become stable? So I hope this is helpful for you. Do not worry if someone says, oh, you've lost a lot of bone. We can look at these 2 bone density reports and it shows a lot of bone loss. The really next question is, am I losing bone right now? And you can find that out with these markers of bone resorption. For more information on these markers of bone resorption and the NTX test, which is our favorite marker of bone resorption, you can go to betterbones.com and search bone resorption tests. Or you can look at our book, Better Bones, Better Body. This is just another way, and an important way, that you can take charge of your bone health by finding out, am I losing excessive bone right now? And by the way, it is the means by which we test to see if your bone building program is working. If you come to our office and we set you up on the whole Better Bones program of lifestyle, exercise, all the 20 key nutrients, and alkaline diet, we want to make sure that program is working. So we look at your bone breakdown when you come, and then we look at your bone breakdown maybe after 6 months. You want to get your numbers on that NTX 40s or maybe 50 or so. And then you can be comfortable that you're not losing excessive bone. So this is Dr. Susan Brown, the Center for Better Bones. It's been my pleasure. I hope you'll take this tip and take charge of your bone health, finding out, are you losing bone right now, before you make any other decisions about your bone health. Have a great day, and we'll be talking to you later.